Good morning. Today is December 10th, 2012, and I am here this morning to interview my supervisor, Miss Hattie Murray, Director of Clinical Services for Sierra Care Hospice. I am going to start by letting her give you an introduction of who she is and some of her background in supervision.
Good morning. My name is Miss Hattie Murray. I am, as Miss Mary has just stated, the Director of Clinical Services for Sierra Care Hospice. I have 25 years of experience in the healthcare field. My supervisory and directory experience spans from Regional Director of Clinical Operations, Director of Nursing Services, Assistant Director of Nursing Services, and a wide gamut of specialty areas in nursing, from skilled nursing, long-term care, rehabilitative nursing to chemical dependency and treatment centers, as well as acute and skilled or acute and specialty hospitals as well.
Okay. Well, as a social worker and in an interdisciplinary team field, which is hospice, I want to know, how do you find it any different in having to supervise one discipline as opposed to the other?
I don't find it different in terms of the essence of what supervising is. There is a difference, of course, with the different responsibilities of each team, of each team member. So as long as there is the role clarity and the expectation of what each team member is responsible for doing, I find that an interdisciplinary approach to healthcare is the best approach to take.
Okay. And so, if you had to come up with a definition of supervision, what would that be, and what would your approach to supervision? How do you view your approach to supervision?
Well, my definition of supervision is, first of all, understanding my obligations to the team that I'm supervising. And setting the expectations and ensuring that each team member is aware of what their role and responsibilities are. Because you can't hold anyone accountable for a specific duty or role or responsibility if they are not clear on what it is that they are supposed to be doing. And then ensuring that they have every tool and every resource to complete the task that they are responsible for.
Okay. And is that your approach, is to make sure that you know exactly what you're responsible for, and then there won't be no smears in expectations?
Exactly.
Okay.
Yeah.
So, out of all your supervisory positions, do you find this one more interactual with what's the word I'm looking for?
Do I find that it's more interacting or interactive in terms of
with the client?
I think that I do, because it is a more intimate setting. I think that when you are, when I was a regional director of clinical operations, I had about 500 or 600 people on my staff, so to speak, that I had oversight of, because I had oversight of different facilities, multiple facilities in multiple states. So it was more of ensuring that they were compliant on paper, and that they understood, things in terms of conducting surveys and the survey process and how to prepare for a survey, so that I help them to be successful in those regards. I find that in this setting it's more intimate, because it is a smaller number on the team, but it is a field, a special area of nursing, where each team member gets to develop a very intimate relationship with the patients during one of the most vulnerable and intimate times of their lives. So I do find it in that regard. I find it to be, there is some distinction there, and it's one that I really enjoy.
Okay. Do you, when you thinking in terms of supervision, you have the educational side and the administrative side. Mm-hmm. In this setting, which one do you think is the most important, if one is more important than the other?
Well, I really don't think that one is more important than the other. I do feel, though, if anyone in a leadership position, if you fulfill your obligation to the individuals that you are leading, in terms of educating them and training them and ensuring that they are competent in the things that they need to be competent in, it actually makes for less administrative work. It does.
Okay. Yeah. So, how involved do you think the supervisee should be in incorporate in the supervision process?
Well, one would have to be very involved because you have to know what's going on. You have to, and this is a term or a slogan that I've picked up over the years, and it may sound kind of cliche, but it is very, very, factual. You have to inspect what you expect. So therefore, if I am expecting for staff members to adhere to the policies and procedures, then I have to inspect their work to ensure that they're doing that. So I have to, on occasion, go on visits with them. I have to review their paperwork that they are submitting. So you have to be very, very involved. It's not an area where you can be kind of standoffish, or a role where you can be kind of standoffish. But it's equally important, though, that the team member that you're supervising, that you're leading, that person understands fully what it is that they are responsible for, and that they also understand that it is okay to let your director know or your supervisor know if there is a task that you cannot accomplish. Simply because someone gives you a task or delegates a task for you to accomplish doesn't necessarily mean that you can actually accomplish it. Okay. So it's a partnership. There's a relationship and a rapport that is built, and there's a partnership there, where it's not an issue of one person being dominant or domineering over another person or a team of individuals. We have a specific goal, and in order for us to reach that goal, this is what each team member has to do. This is the role of each team member in order for us to reach that goal. Now, if I am given a specific part of that in my role as a director of clinical services, that I said, okay, I can't accomplish this, then I have a duty and a responsibility to let the person know who is my superior, in terms of the person that is in a leadership position over me. Then I have an obligation to let them know that I can't accomplish that the way that this is right now. So we may have to reevaluate and to revise some things. So.
Okay, well, how do you view having to be an advocate? Because you mentioned something about your supervisor. Mm-hmm. As a supervisor, do you feel like sometimes you have to be an advocate or a buffer between the people you're supervising and the corporate world?
Most definitely, you do, because you have to understand the initiatives when initiatives are put forth, and you have to know the culture of your team. Mm-hmm. And okay, how is this going to work with my team? What am I going to have to tweak or to kind of change a little bit so it fits the culture of my team? And then how am I going to present this to my team so that my team understands what the overall goal and focus is? But there are times that you do have to be, a buffer. And it's important to know your team members, to get to know, their personalities and how they deal with things, because you cannot approach each team member the same way.
Okay. So, in terms of not approaching team members the same way, are you a bigger advocate for group supervision or individual supervision?
I think that you do a little of both. We of course supervise the entire team because we are a team. We do take a team approach to the delivery of healthcare in our setting. But you also have to be able to identify when a team is only going to be as strong as the weakest person on that team. So as a leader, you have to be able to identify those opportunities. Not necessarily that they're weaknesses, but they are opportunities for an individual to grow. As each member of the team grows, your team is just going to get stronger. So you have to be able to identify and not overlook or overlook isn't the correct term, not discount when you see that there are opportunities that other team members have. Because if you fail to help that person to identify those areas and then work with that person to develop a plan so that person can improve in those areas. You've identified those opportunities. Now that person deserves every resource to develop and to improve in those areas of opportunity that you've identified. But if you discount those and just, turn a blind eye to them, that's not very good leadership. And your team is not going to grow.
Okay. So is it safe to say that you don't view supervision just as a means to an end?
No, not at all. No. I view it as a huge responsibility that there is a group of people that I have been given the privilege and the responsibility to help them to grow. And in the process, I'm going to grow as well.
Okay. So it is more of a interactional approach or process.
Yeah.
Okay. So in communicating, what form of communication do you find more effective when you're supervising?
I find I'm very big on integrity. So I think that being open and being honest is, for me, the most effective form of communication. To just, again, when something is identified, or when something needs to be shared, because that's what communication is for, just a sharing of information, an opportunity and format to share information. So I think that open communication, honest communication, expressing in a professional manner. I think that communication not only needs to be honest, but it needs to be intelligent.
Okay.
And communication is necessary. So even if we have to have a difficult conversation, we still have to have a conversation.
Okay. So is that something as a supervisor you learned over time to be more comfortable with being able to, tell, well, I have to have this difficult conversation?
Right, yeah.
And can you give me a little bit of how that process, how you got from this level to this level?
Well, I got I learned over time and grew over time by other individuals that were willing to invest in me to help to develop me as a leader. Because it is one of the most difficult things to do is to point out areas of opportunities to other people, because you don't want them to feel like you don't like them. That was one of the most difficult things about managing when I first started in a managerial role, was the management of people. The management of processes and systems was okay. However, I had to learn very quickly, processes and systems are no good without people. They're just dead trees. So I had to develop that skill over time, and I did that by, again, by how other individuals taught me and developed me, and then by executing what I had been taught.
So what is your approach to resolving conflict amongst the team or your supervisors?